The National Agency for the Control of AIDS, NACA, continues to strengthen its engagement with the private sector in the country through the Nigeria Business Coalition Against AIDS, NIBUCA, in a bid to increase domestic funding for HIV towards a more sustainable response. Hello and welcome to another episode of The Last Mile with NACA. I am Adesuwa Osui. The HIV Trust Fund of Nigeria is a product of that engagement with the private sector, a powerful public-private partnership to build funding for the fight against HIV.
Ending AIDS as a public health threat in Nigeria will require increased domestic funding. We have continued to make good our commitment of placing more people living with HIV on treatment annually using national resources. However, strong domestic resources mobilization with an enduring partnership and shared responsibility is required to sustain the response to HIV and other emerging public health emergencies. Going forward, I hope the HIV Trust Fund of Nigeria will galvanize more of the private sector and others partners to surpass the target of 62 billion naira in the next 5 years. I now officially launch the HIV Trust Fund of Nigeria.
Launched in February of 2022 by His Excellency President Muhammadu Buhari, the HIV Trust Fund of Nigeria, a 50 billion naira private sector-led funding mechanism, aims to ensure sustainable mobilization of resources from the private sector to make significant contributions towards the funding of HIV programs across Nigeria. The Trust Fund is on the heels of a consensus among political leaders, civil society and development partners that ending AIDS as a public health threat in Nigeria will require increased domestic funding.
NACA had approached NIBUCA with a proposal to fund a part of the Nigeria's HIV interventions, given an existing shortfall in interventions at the time of about $108 million per annum. So what's the background to this? Over the last 2 decades, most of the funding for HIV/AIDS interventions in Nigeria have been undertaken by donor agencies, principally Global Funds and PEPFAR. About 18% of that comes from government, right? And maybe about 1% from the private sector. What we've seen is that per annum, all the partners have been spending about $500 million every year. And we've gotten to a point where partners are beginning to say, you know what, we've done this for 20 years, it's time we begin to move back a bit and Nigeria begins to advance and take over a significant portion of the funding. Today, within the physical space in Nigeria, government doesn't have the capacity to do that. And it was on that note that NACA propositioned Nigeria's business community. So based on this, now the HIV Trust Fund of Nigeria was set up.
It's a trust fund that is created to help, where that help is identified and that request is made to the trust fund. And the trust fund respond by providing services. But in terms of government managing the resources or government managing the trust fund, no, we don't manage the trust fund. We don't manage the resources, but we serve as members in the board of trustees of the trust fund.
The modus operandi of the HIV Trust Fund consists of several tiers of management structure that ensures an optimized and efficient utilization of the funds.
In terms of governance, we have different layers. We have the board of trustees, made up of some of Nigeria's preeminent entrepreneurs and CEOs, right? And then below the board of trustees, we have what we call the board advisory committee made up of representatives of those CEOs. And I mean, it makes sense because these individuals on the board of trustees don't have, they are passionate about the fight against HIV, but because of the scope of what they do, they may not have the bandwidth to handle the day-to-day board operations, right? So they have people who represent them on the board advisory committee. Next, on the same level of the board advisory committee is what we call the board technical committee. The board technical committee will be made up of partners, which include the donor agencies, of course, NACA driving it, include the community of people living with HIV, and subject matter experts who will advise on the best way to deploy the resources and the best place to deploy the resources, and then send it to the board of directors or board of trustees for approval. So, of course, below them is now the management of the trust fund itself. So that's the structure we have. It's important that we note that the HIV Trust Fund of Nigeria is not a program implementer. No, we don't have that. We don't intend to have that capacity. What we serve as is a platform to aggregate the resources and mobilize the resources from the private sector, and then make it available on the existing channels that all the partners and NACA and the Federal Ministry of Health has been using to address HIV.
It has a chief executive, it has a management structure, and the role of this chief executive and the managing group that is assisting the chief executive is to do this work, to reach out to the private sector, to raise fund, and also manage the fund. We are leaving them to do their work. From time to time, when they need our help and assistance, we are available and ready to render. Our job is to make the request.
For the people living with HIV, this is their program. This trust fund is meant for them. At the point when we set up the technical working committee post the fundraising, they will be ably represented. Their voices will be heard. This is where they can drive policy. And it's important for them to note this. We are not doing this. The private sector is not doing it for us per se. I mean, we're doing it for us because we are Nigerians, but this belongs to them. Sometimes you hear things like, we are not sure that we are ably represented. No, trust me, everybody will be ably represented on this platform.
The fund is devoted mainly to funding strategic inputs such as essential commodities and the logistics to deliver these commodities to the facilities.
The way the trust fund is structured is the same way the CACOBID was established and managed during the corona pandemic. The private sector came together. The private sector raised fund and provide government services the government needs. It's the same model we are adopting for HIV Trust Fund. We're expecting the HIV, the private sector to raise fund, and we make requests in terms of commodities that we need, and those include the test kits, they include the agents, and they include also the drugs we give to individuals that are infected with HIV. Added to this is the logistics to take these commodities around to facilities where they are required.
Though established to support the national HIV response in its entirety, the Trust Fund for now focuses on the elimination of mother-to-child transmission of HIV.
The idea behind the HIV Trust Fund of Nigeria is to aggregate, to mobilize resources from the private sector towards this intervention. And then, you can imagine that $500 million is not a joke. So even the private sector itself cannot begin to take on that level of commitment. So the board of the HIV Trust Fund of Nigeria decided that they would take an aspect, look at the entire thematic space and take just an aspect of it. And they felt that it was important that we take the aspect that most people struggle with. And today for Nigeria is the prevention of mother-to-child transmission of the virus. Why is this so? And this is an analogy I always share with people when I talk about this. You are playing a football match, you have top strikers and scoring goals, making progress, on the identification of people living with HIV, on reducing prevalence rates. But every year, they are scoring more goals because you don't have a goalkeeper. Because every year, we have about 22,000 children born HIV positive in Nigeria, every single year. So if you say that you have 1.9 million people living with HIV, and every year you're adding another 22,000, then you have a problem. So part of the targets or objectives of HIV Trust Fund of Nigeria is to provide enough funding, mobilize enough resources to shut down transmission of mother to child of the virus, total eradication of transmission of mother to child of HIV in Nigeria.
If you look at the global figures, you will see significant mother to child transmission takes place in Nigeria. Some of the reason is not because the services are not available. The services are available and they are widespread all over the country. We have over 2,000 facilities where services are provided. And here in Nigeria, if a mother is identified to be HIV positive and she is linked to our services, we have 100% success rate preventing mother to child transmission. Where we have difficulty is the population that is hard to reach. Individuals or pregnant mothers that don't come for antenatal services at facility, pregnant mothers that don't access or don't ask for HIV services while they are pregnant. To know, because that is the gateway to first of all know that there is a risk of mother to child transmission in this pregnancy if the mother is HIV positive. If the mother is HIV negative during pregnancy, that risk is completely eliminated. It's not there. So what we are calling on the general public is knowing that every pregnancy has a risk of transmitting HIV to the unborn baby if the mother is HIV positive. The only way to be sure that the mother doesn't have HIV is by taking HIV tests during pregnancy.
We all can play a critical role in helping Nigeria eradicate HIV. Support the NACA Naibuka fundraising effort today.
This is our problem as Nigerians. This is almost we can't hand over solving our problems to literally outsiders, right? It even amounts to a national security problem. It amounts to a national labor problem. Because if we have a spike in HIV/AIDS again, it means that there's going to be an impact in the labor force. So for the private sector, it's also important. It's important for us that we shut that problem down before it gets any further. And it is within our capacity.
The HIV Trust Fund aims at increasing private sector contributions as increases in domestic funding will boost efforts towards attaining HIV epidemic control on or before 2030.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
This HIV self-test kit has been certified safe and effective by the WHO, Federal Ministry of Health and NACA. For more inquiries, call the NACA Information Center free of charge on 6222. Do not eat, drink or use mouth cleaning products 30 minutes before the test. Find somewhere private with good light and a flat surface. The kit includes instruction leaflets that should be read carefully, a test stand and a sealed package containing a test device, developer tube and preservative used for storage only. This is not needed for the test. Open the test tube and place it in the test stand. Grab the test device by the handle. Do not touch the flat pad. Apply moderate pressure while swabbing the flat pad once along your upper gum and once along the lower gum. Immediately put the test device in the developer tube. Leave it there for 20 minutes before reading the result. Do not read the result after 40 minutes. Test is positive if both control and test lines appear, in which case you should contact NACA Information Center as soon as possible for advice on the next step. Test is negative if only control line appears. Test is invalid if there are no lines or only test line appear or the wipe result background becomes red and should be repeated. Properly dispose all contents in the normal trash. Support NACA and the fight against HIV. Know your HIV status today.
It is our hope that resources that come through the HIV Trust Fund will help to close the gap in access to antiretroviral therapy for people living with HIV. Update segment is next. Keep watching.
The 6th edition of the National Council on AIDS with the theme Innovative Approaches Towards HIV Epidemic Control and Program Sustainability at State Level has come and gone, but the resolutions adopted will go a long way in shaping the national response going forward.
HIV cannot be eliminated until we are successful in terms of finding people that live with the disease in communities, put them on life-saving medication and keep this virus within them. And the last 3 years have seen tremendous growth in terms of the number of people we find. We found close to 1 million, placed them on treatment. That has never been seen, in our history of our national response. So that is why we're bringing everyone together to say, look, united, we're fighting this virus and we're making success. Let us keep this momentum. And let us make sure that we don't get our eyes off the big prize. And what that big prize? Achieving epidemic control and making sure that we stabilize and keep HIV within people that live with it.
The yearly event serves as a platform where all relevant stakeholders meet to provide technical and policy direction to the national response.
We submitted about 3 memos and we are happy one of the memos scaled. The memo that I presented is trying to say that if we want to sustain the gains of the gains so far made on HIV response, there is a need for training and retraining of the HIV program managers. And then the other memo that we submitted is still we are trying to inform the country how Borno State use its initiative and innovation on the community prevention of mother-to-child transmission. Actually, that approach yielded a very, very good result, and we hope that the country will adopt our initiative.
Akwa Ibom State presented a memo on re-engineering coordination at the NACA level. I looked at what we have, the NICE report. From that study, we realized that the bulk of HIV burden is domiciled at the rural area. And that rural level is at the level of the NACAs. That is the Local Action Committee. Now, if we do not strengthen that level to reach out to these people where we have the bulk, we will have a lot of problems. So that, for me, gave a lot of issue, a lot of challenge, a lot of things to worry about. If we must sustain this fight, this response needs to be, taken to the local level, where we can get the majority of people, who are actually suffering from these things and who have less knowledge on how to respond to HIV challenges. So this 6th National Council on Health, I believe, will produce things that will help us to drive sustainability plan. It will produce policies that will help us to sustain the epidemic control.
The council comprises of NACA board members, patient community, delegates from all states and the Federal Capital Territory, agencies for the control of AIDS, and representatives of other stakeholders in the HIV and AIDS response. The 3-day National Council on AIDS meeting was well attended and highly successful.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o, during pregnancy or labour or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce. And medicine don dey to take manage am. See, nowadays people wey get HIV dey live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
Curbing the spread of HIV continues to create a tremendous strain on healthcare systems globally, Nigeria included.
About 300,000 children born HIV positive. Over 20,000 of them were born in Nigeria. This is a crisis of immense proportions, and it can potentially erode all the good work we've done over the last 2 decades. So the HIV Trust Fund of Nigeria is not just stepping in to bridge the gap to raise funding or support government to raise funding for HIV/AIDS intervention. We have decided to focus specifically on the prevention of mother-to-child transmission of the virus.
Every unborn child has the right to be protected from HIV. And we can only do that if we get every pregnant woman tested and HIV positive pregnancies prevented from transmitting the virus to the newborn.
Given the magnitude of the prevention of mother-to-child transmission need, the HIV Trust Fund is timely and will be critical in helping us address the gaps in acquiring test kits, laboratory reagents, and drugs for pregnant women over the next 5 years. We are excited about the private sector commitment to this cause and wish to thank them in advance for their engagement.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesuwa Osui. Goodbye.